deaths, social disruption, economic loss, anxiety and uncertainty about the future, which results in emotional strain and fear about the contagion, health, safety, and livelihoods of the population. Stigma associated with the disease is also a cause of psychological distress. Healthcare workers and frontline workers are at high risk of stress and trauma-related disorders. Further, the social interaction, social connectedness, and engagement in healthy lifestyles. People with severe mental illness, intellectual and cognitive disabilities are often targets of abuse, ridicule, and neglect in their communities. These individuals will most likely lack care or support to adhere to the containment measures and may even be homeless to begin with. All these challenges predispose this socially vulnerable population to a high risk of contracting COVID-19 and therefore their continued well-being and quality of life. Supporting mental health remains one of the government's highest priorities. The Ministry of Health and partners are continuing to take action to help Kenyans whose mental health and well-being is being affected by the pandemic by providing mental health and psychosocial support strategies and measures which are critical in the short and long-term response to COVID-19 pandemic. These interventions and services that the government is providing include prioritizing mental health and psychosocial support systems, mental health and psychosocial support social teams are providing mental health and psychological services to the general public, to those who are quarantined and hospitalized, healthcare workers, and high-risk vulnerable groups. Government is also providing 24-hour access to tele-counseling services that provide psychological care via hotline numbers 1199 and 719. And implementation of the Presidential Directive on Mental Health and transformation of the Mathare Mental Hospital into a semi-autonomous government agency or a parastatal to provide referred specialized care, training, and research in mental health. We have talked about mental health today because that is one of the areas and mandates of the Ministry of Health. So even as we are in an era that is focused upon the COVID-19 pandemic, as a ministry, we ensure that this does not remove our focus from our other mandates of providing essential health services to the general population. And clearly mental health is important. It also has a bearing during this period that we are going through because the pandemic and the response to the pandemic has created a great deal of anxiety, anguish, and worry within the population. Fellow Kenyans, let me now move on to the data on COVID-19 over the last 24 hours that we have collected. We have tested 2,820 samples in the last 24 hours, out of which 104 have turned out positive. Therefore, as of today, the overall COVID-19 disease burden in the country is 4,478, and the total number of tests that we have conducted is 136,361. All the 104 positive cases of today are Kenyans. 76 of them are male and 28 are females. The youngest is 1 year old and the oldest is 76. We have seen the pattern of distribution. It remains the same, with Nairobi County leading with 60 cases, Mombasa with 33 cases, Kilifi 5 cases, Busia 3, Kajiado 2, Taita Taveta 1 case. By sub-county, if we take Nairobi, the distribution of the 60 cases from Nairobi today are from Langata 22, Kibra 19, Westlands 11, Starehe 3, Dagoretti North 2, Embakasi South 1, Kasarani 1, and Embakasi East 1. In Mombasa, the 33 cases are from Changamwe 13, Mvita 8, Kisauni 5, Jomvu 4, Likoni 2, and Nyali 1. In Kilifi, the 5 cases are from Rabai. In Busia, the 3 cases are from Matayos 2 and Teso South 1. Kajiado's 2 cases are from Loitokitok, and Taita Taveta case is from Taveta Town. I'm also pleased to inform you that today we have discharged 36 patients from our various hospitals, bringing the total number of recoveries to 1,586. Once again, we want to salute and thank our healthcare workers for their commitment and dedication as they continue to serve members of the public in this response. Regrettably, we have also lost 2 more patients to the disease, bringing the total fatality to 121. Our condolences and prayers go to the affected families and their friends. Fellow Kenyans, as I conclude, I want to take this opportunity to commend Kenyans, the majority of whom have responded to our calls, have responded to the containment measures, and for the critical role that they play in this containment effort. Once again, the responsibility lies with us, each and every one of us, as Kenyans, to protect ourselves and to protect others and to stop the virus in its tracks. The gains made so far would not have been possible without the collaboration of the public. We do understand and we do appreciate that the containment measures and the restrictions that have been placed are burdensome and difficult to bear at times. But we cannot relent, and we must put up with these burdens, these sacrifices, so that we can be able to manage the way this virus spreads within the community. I urge our people to continue working together and support the government to komesha corona. Thank you. Only 3 questions today. That will be.
My name is Brian Utieno from KTN News. There are reports that about 30 healthcare workers at the Pumwani Maternity Hospital have been quarantined after a patient who was admitted there for about 9 days tested positive for COVID. How true are the reports?
My name is Anita Nkonge from NTV. My question is in regard to the report that 3 police officers at Kamkunji Police Station were tested positive for COVID. Can the ministry please comment on this?
My name is Nancy Okware from KBC. On the 26th of April, you unveiled a number where people who are undergoing difficulties in terms of mental health can actually call to receive assistance, and that was owing to an increase in the number of domestic violence cases in the country. So far, how has the response been like? Are Kenyans really embracing this help that is actually being offered to them? Thank you.
My name is Chemutai going from Citizen TV, and just following up from the question from NTV, the situation at the Kamkunji police station, how many people so far been put on quarantine or isolated as they wait their results? And then also police officers, we've seen some of them as they try to restore order, even in the political meetings that have been happening. Some of them actually are not even wearing the masks. And now with even the cases now being reported by the enforcement officers who are also sort of frontline, what are you doing to also handle that situation? And in Mombasa County, the courts have been closed temporarily after some of the judicial officers tested positive. There are remandees and even people who are brought in there possibly to answer to charges. What is the situation even in the prisons in Mombasa? Thank you.
Okay, thank you. Let me respond to some of the questions. The others, where we require some statistics, I will hand over to Dr. Amoth, the DG. The first question was regarding 30 healthcare workers in various hospitals. I didn't really catch that question very well. I don't know what it is you wanted to know about this 30. Can you please repeat it?
Yeah, there are reports that about 30 healthcare workers at the Pumwani Maternity Hospital have been quarantined after a patient who was admitted there for 9 days tested positive for COVID. So I wanted to know if the reports are true.
Okay, we will, I don't have that information on hand, but perhaps the DG might. All I will say on this is that when we do find situations where a number of people within an institution or a facility that is rendering services to the public, especially these are our frontline healthcare workers we're talking about, they turn out positive, then we have to take the necessary action to ensure the rest of the healthcare workers, as well as patients who will be coming into that institution, are safe. And we go through the normal protocols and procedures, which means that these individuals who have worked with them and who have been in contact with them within that institution are then also investigated, tested, and if necessary placed in quarantine for a certain period of time. So that is the protocol that is in place for any institution that records some positives among the workers there. I will have the DG tell you about the numbers and what's happening on that. NTV, again, Chimtai from Citizen wanted to know about similar situation to this one we're talking about, but this time involving police officers in Kamkunji police station. Am I correct? Yes, again, I think the response I gave applies for this institution as well. And I will allow the DG also, if he has any numbers on hand, to be able to share that with you. Okwaro, KBC. You said on the 25th of April we outlined what we're doing in terms of mental health support, and we gave out a hotline for people to respond to. I have repeated today, I think, the hotlines, which are 1199 and 719. I think your question was, can we give you an idea of how many people have actually sought services through these hotlines? Again, this is data that we may not have on hand. If we don't have it on hand, we will make sure that we are able to collect this data and respond to you, perhaps at our next presser, but the DG again may or may not have this information on hand. Chemtai, Yours was generally about frontline healthcare workers, and especially the police officers as they go about their duties. How do they need to be protected? What we can tell you is that we have placed a great deal of emphasis on all frontline all frontline workers. Now that includes healthcare workers, but it also includes other government workers who are providing services to the public, including the security forces, the discipline forces, and many others that provide services to the public and interact with the public very closely on a regular basis. We have been able to reach out to these groups of people. We have trained people who are able to train them within their ranks on how they should be able to protect themselves. We have extended all the PPEs and other tools that they need to be able to protect themselves. And we have also provided the guidelines on how they should be able to conduct themselves during the course of their services. So they are prepared. We may find now and then some that might not, in the course of their duties, observe some of these procedures. But as a ministry, we have collaborated with all the other sectors where these workers are, and we have supported them in being able to observe and adhere to protective measures to protect themselves. DG, maybe if you can say a word or two on that if you have anything to say on it. Now, I think the Mombasa court, the Kamkunji police station, the Pumwani, all of them, I guess, is the same answer that applies to all of those, including the remandees. And we have talked before about the prison situation, particularly remandees, people who are being held temporarily in confinement somewhere as they await their court cases, and a link that they might provide from the outside world to these closed systems in the prisons. I think the work that we have been doing together with the Department of Prisons really has been first and foremost to protect those in this closed environment of prison situations, to completely protect them and prevent any outside contact that will bring in the virus. Those remandee stations, again, we are doing the same when we do find that there are individuals who are being held in remand and they do display some symptoms. They are isolated from the rest, and we apply the same procedures of protection so that that community also is minimally affected by spread of the virus. Let me hand over to the DG to fill in some of the gaps that I might not have responded to.
Thank you, Waziri. I think you have addressed these issues very, very conclusively. I'll just add in a few points here and there. I think in terms of the healthcare workers in Pumwani, the police officers in Kamukunji, as a standard practice, in case we find an infection in any focus, it is a standard practice that we do contact tracing and we quarantine the people who have come into contact with that particular case. And that will apply irrespective of where the infection occurs, be it a police station, be it a health facility, be it state house. The guidelines and protocols are clear and they apply across board. In terms of the number of cases that we have seen following the launch of the helpline, yes, the response has been very good. And surprisingly, it's mostly the young people who have been making calls. And most of the issues that they want to address include anxiety, include gender and domestic violence, and also issues of depression. And we want to ramp this further and establish a telecounseling service at Mathare National Teaching and Referral Hospital that will also be able to serve us post-COVID. In terms of the prisons, you remember prisons because of the high population and the impracticality of maintaining social distance was highlighted as one of the hotspots. And even the first edict that His Excellency made was stoppage of visitation to the prison, all our prison facilities. And I think that has gone a long way to be able to stop spread of COVID-19 in prisons. Or you remember one time we had 21 cases that were reported from industrial area remand prison, and it's because of the same measures that we put in place, including isolation, contact tracing, that we managed to be able to stamp out further spread. But going further, of course, we have worked with the prisons services very, very well. Remember also the PS, Correctional Services, sits in the National Emergency Response Committee, and we work very, very closely with them. We have ensured that they have the proper personal protective equipment for the healthcare workers. They have also designated isolation and quarantine centers in prisons. Because remember, if you get a prisoner, say from industrial area to take to Kenyatta University Teaching and Referral Hospital, then you require the prison wardens to go and take care, provide security for this individual person. So to avoid that risk of exposure, we have ensured that the prisons all over the country have designated isolation and treatment centers, and only those people who are symptomatic then will require to be moved to other facilities. We have also done capacity building for the prison officers or the prison wardens and the healthcare workers who serve in the prisons to ensure that the guidelines and protocols are maintained. And of course, in case of any reported case in prison, of course, contact tracing and quarantine and isolation is practiced as a standard procedure. Thank you.
Okay. Thank you.
Mwago wa Kameme TV reu uri gucokereria Kiengei Live reu ne cokereirie na thinga munene na mururumo nyitanira na Kiengei Live o muthenya wa Jumamothi thaa 2 nginyagia thaa 3 na muthenya wa Kiumia thaa 2 nginyagia thaa 3 cio tuku.